Hello, and welcome to the Anxiety RX podcast. I am your host, Dr. Russell Kennedy. Recently, I did a Q&A session for my MBRX people, the people that are in my MBRX program. And the session went about 2.5 hours long. So it's a very long session. So I've chopped it up into 4 segments for the podcast. And I hope you enjoy the segments. I hope you get something out of it. It gave me a chance to really explain my theory of anxiety based on what people ask me. Often I will say, this is what I believe anxiety is. But when you get the questions from other people, it really helps me elaborate on exactly what I mean and made it personal for a lot of people. So I really hope you enjoy each segment. Question 16, how do you truly let go of the hurt in your heart and soul from past trauma? Well, that's a big question. That's a big question. How do you truly let go of the hurt in your heart and soul from past trauma? Take a breath. I don't know if you let go of it. I think that you metabolize it. I think there is this sense that just let that go. And that's a cognitive piece, like, I'm just going to let this go. And I think so much of the hurt is subcortical, is in the deeper structures of the brain. Like if you look at the brain stem that sort of controls your body, and then the amygdala and the insula that mediate some of these traumatic memories, none of those structures understand language. They understand feeling. Feeling is their language. So trying to use words to heal from trauma is difficult, and I think almost impossible. Now, where I do think words are helpful is after you've done the somatic work, like I was saying earlier. Once you do the somatic work, then you've got a foundation to build the skyscraper, to build this place where things aren't as bad. It isn't as traumatic. It isn't as painful. And then you develop this confidence like, oh, that happened to me, but I'm okay. And the more that confidence comes up, the less victim mentality we get into, because victim mentality is so pernicious and it's so devastating because it doesn't allow us to escape. It's like a hole that we can't get out of. Victim mentality. It's one of the worst things about being a human being is this victim mentality, because you can't heal from that position. And being able to kind of go, yeah, that happened to me. I didn't like it, but I'm moving through it. It doesn't trigger me into worry. It doesn't automatically fire me up into my horrible thoughts, worries, what ifs, worst case scenarios. It doesn't do that to me anymore. And then you start developing this sense of confidence, like what I was saying earlier about when I would give people with panic attacks a couple of tablets of Ativan or Xanax or something like that. They would take it, and then it would help with their panic attack, and then they never had to take it again. They just had to know that they had it on their person. And if they did have a panic attack, they knew they had it with them so that they were okay. It's like, okay, well, I don't like this, but I can handle it. I think it's the same kind of thing. You develop this confidence that, yeah, this happened to me. This is painful. I've kind of done some work on it. Like I was talking about earlier on with this particular thing about pendulating or oscillating between that feeling of trauma that for me, it's in my solar plexus, and then moving up to my sinuses and my face, and just the breath, how calming that is, the sound of my breath going through there, and then going back into the trauma in my solar plexus of, dealing with my schizophrenic father and all the crazy things that he did, and then just moving back and forth between those things. I think that the trauma is always there. Like the amygdala never forgets. The trauma is always there. But I think our perception of it changes. And I remember years ago, and I put this in the first book, about having an email from one of my patients, my anxiety patients, and she said, Dr. Kennedy, I'm running out of my anxiety medication and I need a refill on my perception. Now she meant to say I need a refill on my prescription, but a refill on your perception was like, that's what I was going to call the first book, because it was such a great title. But I think it really is about how our perception. So the trauma is always there. I think it always hurts. It always brings up the alarm. Let's put it that way. And then the more familiar you get with the alarm, and the more connected you get with the alarm, because I do believe that alarm is a younger version of you. The more connected you get with that alarm, the more you feel like, oh, okay, I'm in this together. Like the younger version of me and the adult version of me, we don't have to feel this as highly aversive anymore. We can actually start using it as a place of growth. It's like, yeah, this happened to me, but I'm actually moving past it. I'm actually able to stay with it, stay with the pain, and be and not get into this like, oh, and it made me strong and none of that stuff. Not that there's anything wrong with that, but just being this like, I feel this alarm from this particular events, and I'm okay with it. You know, like my dad, some of the crazy things that he did, man. Like even now when I think about it, it's like, yeah, I kind of laugh. I kind of like, okay, I made it through that. Whereas 5 years ago, that would have been very difficult for me to kind of just get past that thing. And my ego would have lit me up and started explaining that he was crazy and he never really loved me. He couldn't really connect with anybody. I get into this verbal diarrhea. None of it was true. But again, it was my cognitive bias. Like I wanted to make a reason out of it. And I think as you kind of heal your heart and soul from past trauma, you don't need to make reasons out of things anymore. It just is. And it's like, it still hurts. It's still painful, but you get through it. I guess the analogy that I think is like, I had some bad breakups when I was younger and I made it through it. And when I think about those people now, it's like, yeah, I can still bring up the pain, but there is this sense like, okay, yeah, all right. And it's not like I made it through it and that sort of stuff, although there is a little bit of that with it. But I think it's just this sense that, life is painful. Life is painful. And it's not being a victim, I think, and connecting with all parts of you and accepting all parts of you and not rejecting the part of you that was rejected when you were younger, which is probably a topic for another podcast. But the question, how do you let go of the hurt in your heart and soul from past trauma? Again, I don't think you let it go. I think that you metabolize it. I think that you bring it closer. I think you actually allow it to see it as a wounded younger version of you and see them, hear them, love them, and protect them. That younger version of you. And in that, you're in it together. I hope that makes sense. Question 17. Hi, I've been doing the yoga nidra practice 2 to 3 times a week for the past 2 months. Good for you. And I've only had a roughly 10% improvement in anxiety. Wow, you get it down to a percentage. I've only had a roughly 10% improvement in anxiety symptoms. Additionally, I meditate and I have gratitude practice as well as working on my childhood wounding issues. Is there any hope for me to improve? Anxiety is a lifelong problem for me and I'm in my late 40s. Never had meds and CBT hasn't helped. I think just keep going. I think that we're so used to, I need to improve. Because what I do see with people is once you get past that initial ego flare of anxiety, when you start feeling not safe to feel safe. So when you start feeling safe, the ego goes, no, we can't have this. We weren't safe as a child and this is terrible for us. Once you get past that, once you work through it, I think the healing becomes, at least this is true for me, it became exponential. I would heal. It was almost like on a daily basis, I would just feel better and better and better. And this was not to say that I don't go into alarm periods, but I know what to do with them now. Like it's almost like I've been there before. I got the t-shirt. I know how to get out. I think it really is just keep going because a lot of these programs got put into us over the course of years from the time we're like 4 years old till like 12 or 15 or whatever. And we're not going to heal them in 2 or 3 months. And this is one of the things that really starts to upset me as I see these things like heal your anxiety in 7 days. And, I tried the program of healing your anxiety by putting a nail in the side of your head. And within 2 days, I felt so much better. I was virtually healed. I didn't think about my anxiety anymore, but the nail inside of my head still hurts. These programs took a long time to get rooted into this subconscious, this subcortical part of your system. And it's going to take a while of changing the feeling before you actually start rewiring that network. or overwriting that network, because the amygdala never forgets. Like, you'll always have this sense of like jarring from your old traumas, but it's this feeling like, oh, I've been there. I know it's okay. I can just keep going. I can stay in the ice water. I can stay in the discomfort because I know I can process it, and I can move through it. I'm no longer trapped in my head. I'm no longer, as soon as I feel the alarm, I go up into my head and just start worrying and just start clicking it over and over and over again. And I think that's how we heal. I think is just, we just keep going. Now, a therapist, a somatic therapist, or a IFS therapist might help you. I think getting some external help is always beneficial, provided that person knows about somatic therapy and they're not just, talking to you about the cognitive aspects of your anxiety. But I find that people kind of heal in this kind of exponential way. Like, initially, yeah, it's like going through the reeds. Like, it's hard. And the ego doesn't want you to heal in a way because it believes it's keeping you safe with all these what ifs, warnings, and worst case scenarios. But once you get past that, once you kind of say, well, thank you, ego dragon. I appreciate you're trying to help me, but I'm just going to keep going. I'm just going to keep feeling this and allowing myself to feel it. And eventually the ego dragon kind of realizes, oh, okay, well, this is working. So maybe we can back off a little bit. So I would say, just keep going. Just keep going. Maybe get yourself a therapist, but it's really important to just stay on the track and just be willing to feel the pain of it and acclimatize to that pain, and maybe pendulate back and forth with something that feels good in your body. There may be other things that you can do. And the next book will probably help you. The next book is the second edition of Anxiety RX, which is about 50% different than the first edition. There's a lot of new stuff in there. It's a lot more practical. And I think it will help millions of people. So keep going. Question 18, your program works very well. And the more yoga nidra I do and the resistance meditation, the better I am. Will I always have to do it? When will I be able to stop thinking about my childhood, or is that ignoring my younger self? I think we stop thinking about our childhood specifically. I think we just start being this whole being. Because one of the things about integration, and Dr. Dan Siegel talks about this, is taking disparate parts of us and then moving it into a functional whole. So for me, like, there's the bully part of me. There's the part of me that had to deal with a schizophrenic father. So these things created these sort of disparate islands in the storm kind of things for me. And it was, can I bring them all together into one sensation, one feeling of alarm, and connect with that younger version of me? And then the more I connected with the younger version of me through that alarm, the more I felt that I wasn't split into so many different personalities or different subtypes of me. Now, I know that doesn't make a whole lot of sense, but I think there was a part of me that got really irritable. There was a part of me that got really sad. There was a part of me that got really frustrated. And I think I've been able to pull all those things together and realize, oh, this is my old wounding coming up. Can I just accept that wounding instead of like we're talking about letting go? Talking about letting go of it, it's like, can I accept it? Can I bring it closer to me? Can I allow it to be there? And again, I think it's exponential. I think that we get to this place where it's like, oh yeah, this is what Dr. Kennedy was talking about. This is what he was saying. Is like, I get to this place where it's like, oh, I look back and measure myself by where I was instead of, where I'd like to be. So a lot of people, it's like, oh, I still have anxiety. This doesn't work. It's like, well, where were you 6 months ago? Where were you 2 months ago? And then once we see that we actually are making progress, and it may not be perfect, but I do notice, between that sort of ego response of, no, we can't feel safe. The ego won't allow us to feel safe. And then suddenly kind of getting that thing where it's like, you know what? This is uncomfortable, but I feel like I'm more of a whole person. I'm feeling more like a whole entity rather than this. There's an alarm part here, and then there's another part over here. Like it comes together, and you sort of feel this alarm as kind of a whole person. So it's like dropping like one of those little cubes of sugar into a liter of water. It's not going to make a whole lot. It's not going to make it taste a lot sweeter. But if there's only, okay, I did that wrong. So if you have a small cup of water and you put a cube of sugar in it and you taste the water, it's going to taste really sugary. But if you drop that same cube of sugar into a liter of fluid, it's not going to have the same density. And that's kind of the analogy that I use, is that the trauma is still there. It's just like there's almost more of you. There's a bigger vessel to contain the trauma. So it's not as punctate and specific and intense as it would be, because there is this feeling like I'm in charge of this. I'm in charge of how upset and how worried I'm going to get over this particular thing. And sometimes it does take me away, I'll agree, but I see it earlier and earlier and earlier. And as I become more functional, as I become less triggered, I'm able to kind of allow it to be there and kind of enjoy the pain a little bit. Like there's a part of me that really kind of enjoys my anxiety now, which sounds really weird because it kind of reminds me of where I was. You know, when I haven't thought about it till now, explaining it. It's like when I feel my anxiety now, it's like, oh yeah, I remember you. I remember you. And you know, what do you need? Because there's probably part of my younger self that isn't feeling safe or whatever. It's like, yeah, what do you need? And I'm so much more so much more functional now than I ever have been before. So I think that's kind of how I would explain that. So I'm going to read the question again. So your program works very well, and the more yoga nidra I do and the resistance meditation, the better I am. Will I always have to do it? Probably not. When will I be able to stop thinking about my childhood, or is that ignoring my younger self? Again, I think it's a natural byproduct of continuing to stay in connection with yourself. I just think it naturally starts to heal. Also, is exercise a way of resisting? I don't think so. When I was anxious, it was the only cure for alarm and often took an hour of cycling before it settled. Well, I mean, you're burning out a lot of the epinephrine that was just sitting in your brain causing problems when you exercise. And it relaxes your muscles after. So there is a sense after you exercise, yes, of peace and calm. It almost forces your body into this sort of relaxed state. So I think exercise is helpful. I think it creates a sense of safety. But when you finish exercising, can you really focus on that sense of safety that you have, that sense of relaxation? Can you say, okay, how can I feel this? How can I feel the sensation that I feel now that I've done an hour of cycling and I'm feeling relaxed? Can I take a mental picture of this, you know, through my insula, through my amygdala? Can I take a mental picture of this exact sensation? And can I replicate this sensation? Can I, without having to exercise? Now, I'm not saying don't exercise. I'm just saying, once you've been there, once you've seen the other side, once you've seen that I was anxious an hour ago, and now after an hour of cycling, I'm not, what's different? What's the sensation now? How does my alarm feel now? Has it changed? Or is it just feel like there's a blanket been thrown over it? Now, this, again, I'm compacting this into quite a small container, but it's really, what's different? What do I feel after exercise that I don't feel when I'm anxious or alarmed, I should say? What comes up for me and allows me to kind of just understand that this feeling that I have is a sense of safety. And can I embrace that sense of safety rather than saying, oh, this is only going to last a certain amount of time? Or being a victim to, oh, I always have to get out on the bike whenever I feel anxious. There's nothing wrong with that, because clearly you found something that helps you. But I would like you to take a mental picture of what your body and mind feels like after exercise and see if you can recreate that without the exercise. It won't be as easy, But at least you know, like once you've seen the other side, once you've seen and felt relaxation and you have a picture of it in your mind, you can sort of start bringing that back in and practicing. How does that feel? And every time you do the cycling, you'll get better and better at how that feeling feels and to be able to stick with it. So I don't think you'll be doing it for the rest of your life. Again, I say there's this exponential sort of healing. I don't think there's anything wrong with having a meditation practice, by the way, or an exercise practice. I don't think exercising is a way of resisting specifically, but yeah, in a way, it's kind of like, okay, I'm going to do this to get rid of the anxiety. So you could make that out like that is a form of resistance, but it's a sublimation. It's taking the energy and using something that helps you. What I would say is like add sort of the connection with yourself at the same time. It's not just the exercise. It's when you get into that realm of feeling safe, can you extrapolate that out to all of your body? Can you let that relaxation like go into your toes and go into your fingers? And can you really have that sense of safety, that sense of relaxation, that sense that the anxiety is gone? Because most of us don't work on our anxiety until the anxiety comes up. And then you know, it's like trying to practice in the middle of the game. You really need to practice before the game. Like the thing I said about the basketball, you have to practice so that when you need it, it's there. So that's what I would say about exercise. I think it can be a useful sublimation of finding a place where you feel safe and then really focusing on that thing, rather than what happens with people normally is they exercise, they feel better, and they just forget about it. It's like, oh, well, I feel better now, so I'm not even going to worry about it. Literally. And really, it's like when you feel better from exercise, how does your body feel? Exactly. Like, how does it feel? And can you replicate that sense? And if you can, then bring that into the next time that you're feeling anxious. Question 19. You have mentioned that LSD had helped you recognize the alarm in your body, and I have often heard people mentioning microdosing LSD and magic mushrooms to aid in anxiety recovery. What are your thoughts on microdosing psychedelics over using conventional medication for anxiety work? Loaded question. There's a lot of stuff there. I think that psychedelics aren't a panacea. I think microdosing is great. I think it is a way of sort of introducing yourself, specifically with psilocybin. I don't know a lot about microdosing LSD, although I don't know a lot about microdosing psilocybin either. But I think, again, it has that similar thing to ketamine, is I think that you get this dissociation. You sort of, I'm not the same worried person. You can kind of almost see that worried person and go, that's not me. I'm in this place right now. And it feels strange. Like it feels strange. Like normally I'd be worrying. Normally I'd be in this alarmed, worrying state, but I'm not. So you've dissociated kind of out of that. So again, it's like seeing the other side, seeing like the side of safety, and being able to understand that this is within you. This is within all of us, but it's deciding, it's overpowering that ego, which is very powerful, to sort of just take the easy route back into worry. What are your thoughts on microdosing psychedelics over conventional medication? I don't think it's a either or. I mean, I think it's kind of this and. I think there are contraindications sometimes with taking SSRI medications with some of the psychedelics. So that's a consideration. But I think the conventional medications are long term. You take them every day for maybe the rest of your life, whereas the psychedelics offer the opportunity of seeing the other side in a different way, so that you don't necessarily need to take a medication every day and the SSRIs have a lot of side effects, weight gain, sexual dysfunction. There's a lot of stuff that goes along with the SSRI medications. And for some people, they don't really work that well too. And I would say for most people, they don't work well. For some people, they work actually quite well. And that's an issue as well, because some people who find that taking SSRI and their anxiety is considerably improved, the main issue I see with them is they'll come back and they'll say a year later, it's like, I don't have my anxiety anymore, but I don't feel much of anything. So SSRIs, I think that they're useful medications for sure. I think they can be used to kind of avoid going in and doing the hard work of healing the trauma, feel it to heal it, feeling that trauma. So I think it's important to understand that the SSRIs, the conventional medications, are typically long term, whereas the microdosing can help people not have to take something every day and give you a different, more holistic perspective, more long lasting perspective on your anxiety, and help you maybe really connect with the wounded part of you better than, certainly better than conventional medications, for sure. So that's my best answer on that one. Question 20. Okay, I did it. I made it. I made it. I've come a long way in the past year with the understanding and calming the alarm, but how do I take those bigger steps? Taking a vacation again, especially, is something I want to do. I feel like there's still a lack of trust in myself. In my day to day life, I'm feeling like myself again, mostly calm, or at least able to breathe into the background alarm and quiet it down quickly. But I still have that what if the alarm rages if I start traveling again? How can I prepare to really go out into the world again? I think baby steps. I think that you lean into it, like what I was saying earlier about lean into the balls of your feet, move forward into it, because if you move forward into it, your brain chemicals will support you. If you start going, oh my God, I can't do this, I can't do this, I can't do this, then it's going to be difficult for you, because your brain will give you what you think. So if you think I can't do this, your brain will say, okay, we can't do this, let's back off, let's give you all sorts of charging chemicals in your brain. Whereas if you think, okay, you know what, I'm going to give this a try, I am going to move into this, I'm going to lean into the balls of my feet, I'm going to go at what scares me, and I'm going to accept that my alarm is going to come up. But I'm also going to accept that I can put my hand on my chest, I can breathe into it, I can do these practices in advance. So what I would do is I would start with short trips. You know, I had a number of people that I've worked with before who have difficulty driving. They can only drive within 5 kilometers of their house or whatever, or they can't go on the highway and that kind of thing. And I think it's just starting off slowly. And I think you'll surprise yourself. Like, one of the things about anxiety that is very difficult to overcome is that anxiety makes you feel like you can't handle it. And then on top of that, it tells your body that you can't handle it. So you get double whammied in a way, in that your body flares up and then your mind says you can't do this. So it's very difficult to overcome that. So it's developing a sense of safety in practice. So I think you're practicing this in a way. And I think you're probably going to do a lot better with vacations than what you think you are, because you've done this work on them. There may be a flare for sure, but by the same token, you've created this sense of safety, whether you know it or not. And there is a reservoir, there is some capacity and resilience that you built in your nervous system from this. So taking a short trip somewhere, seeing how you do with that, and having the attitude throughout it that, yeah, this might come up, but I'm resourced. I know what to do now, which is basically what happens with me. Is like, I still get alarmed, but it's like, I know what to do now. And it's not like it goes away completely by any means at all. And sometimes it'll last for a couple of hours and it's very uncomfortable. But there is this sense like, I know what to do now. I don't have to freak out about this. I don't have to start getting into worry. I don't have to start going into my mind and working out all the permutations and computations and all this sort of stuff that comes out with it. I can just stay with it. I know it's going to go. I can breathe in. I can stay with it. And then I can be more curious about, okay, where's this coming from? So when you go on a vacation or you go away, yeah, stuff will come up, but you can handle it. Whew. Well, that was the longest session I think I've ever done as a video. We'll have to probably chop this up and see. But for those of you who bought MBRX, I'm very grateful. I think it will help you. My new book comes out in September. It's a second edition of my first book, and I think it's the best work I've ever done. So between MBRX and the new book, this is groundbreaking work for anxiety. And I don't want you to have to suffer like I did. That's my main reason of doing this. I mean, it goes back to my dad. You know, I wanted his suffering to mean something. So that's why I created this stuff for everybody. But I don't want you to have to suffer like I did, because I was almost suicide or pretty close to suicidal with anxiety. And it's a horrible, horrible, horrible feeling. And as a doctor and a neuroscientist and with roots in developmental psychology, knowing that a lot of this stuff starts in childhood, I want to make sure that you're armed with the absolute best way of healing your anxiety based on how I healed my anxiety. So thanks for listening. Keep the faith, baby, and keep going. And that will conclude this segment of the Anxiety RX podcast and this segment of the Q&A. And I hope you join me next time for the Anxiety RX podcast. And thanks.